from a historical standpoint, Guinness Book of World Records standpoint, you are the first United States case that was ever diagnosed with a stage 3 lung cancer and was transplanted with both lungs and a liver for therapy.
Correct. That's groundbreaking. That's landmark. Because as we know, you pick up a book of pulmonology and you look at management of lung cancer, advanced stage, and nowhere in my mind do you see, oh, you can have a bilateral lung transplant if you stage 3 or 4 advanced lung cancer. It doesn't exist.
No, because everybody's scared of the immunosuppression.
Exactly. Or they don't have the methodology to prevent cancer cell spread during the procedure. The whole methodology was pioneered during COVID by this hero thoracic surgeon who did double lung transplants in end-stage COVID patients with respiratory failure due to pulmonary fibrosis. And he pioneered it and then extrapolated it to advanced end-stage cancer.
When I think about it, just like selfishly speaking, I'm like, I mean, people have bone marrow cancer. We wipe out their bone marrow and give them new bone marrow and put them on immunosuppression. Like,
Yeah.
from an organ perspective, what's the difference? You know, like, you know what I'm saying? I'm
I
kind of
know,
like,
yeah.
you
Why,
know,
why should that be the roadblock, right?
yeah, why does that have to be the roadblock?
Yeah.
And you're kind of that, you represent where we want medicine to go. Not saying that, you know, we want individuals to have to pass away to have it done all the time, but I'm just saying that, like, you are a living, breathing reason and a living, breathing example of the evolution of medicine. That is what you are. And
Thank
when I think about it, knowing you the way that I've gotten to know you over the last month, you're pleasant, you are passionate, you are clearly driven, you represent medicine in great ways in 4 different fields, and you represent the evolution of medicine. To have you sitting in this chair is an absolute honor. I mean, I just want to give you that compliment. But you go through the transplant and you really have nothing bad to say about the surgery. Everything went well. What happens next? I mean, I don't know if this is all within, you have the transplant 2 weeks since you're at Northwestern, and this was 2 years ago.
That's right. I'm coming up on my 2-year anniversary, the end of this month, the 26th of this month. Next week will be my 2-year
So do
transplant anniversary.
you go to Chicago every 6 months or something? Is that it's
I have been,
Bronx and biopsy and all?
yeah, I have been going back, but I've also established my transplant care here in Los Angeles with UCLA in particular. But I do go back. Otherwise, I get regular care here in Los Angeles as well.